Which medications trigger drug-induced lupus? I am lupus, a complex condition that can affect many parts of your body in unpredictable ways. One interesting aspect of lupus is that it can sometimes be triggered by certain medications. This is known as drug-induced lupus erythematosus. It mimics the symptoms of systemic lupus erythematosus but usually resolves once the offending medication is stopped. Several medications have been associated with drug-induced lupus. Common culprits include hydralazine, which is often used to treat high blood pressure, and procainamide, a medication for heart rhythm disorders. Other medications that may trigger this condition include isoniazid, which is used to treat tuberculosis, and certain anti-seizure medications like phenytoin. Symptoms of drug-induced lupus can resemble those of systemic lupus. They may include joint pain, fatigue, and skin rashes. However, the symptoms typically improve after discontinuing the medication. It is important to note that not everyone who takes these medications will develop drug-induced lupus. Individual factors such as genetics and overall health play a significant role in whether someone will experience this reaction. Diagnosing drug-induced lupus can be challenging. Doctors will look for a history of medication use along with clinical symptoms. Blood tests may show the presence of specific antibodies, such as anti-nuclear antibodies, which are common in lupus patients. However, the presence of these antibodies alone is not enough for a diagnosis, as they can be found in other conditions as well. If you suspect that a medication may be causing lupus-like symptoms, it is essential to consult a healthcare professional. They can evaluate your symptoms and determine the best course of action. In some cases, they may recommend switching to a different medication or adjusting the dosage. Understanding the link between medications and lupus is crucial for effective management. Ongoing research continues to shed light on how various drugs can affect the immune system and contribute to lupus. While drug-induced lupus is a rare condition, awareness of it can help patients and healthcare providers make informed decisions about treatment options. Always remember that individual experiences with lupus can vary widely. What triggers symptoms in one person may not affect another in the same way. Therefore, personalized medical advice is vital. If you notice any unusual symptoms after starting a new medication, do not hesitate to reach out to your healthcare provider for guidance.